to Medigap show. I'm Holly Cohen, licensed agent. We are going to explore savings by comparing plan rates. If you haven't already subscribed to the channel, please do. We like to get all this information out there to as many people as possible, and it can be confusing if you don't know all the details about Medicare. So this video is intended for those Medicare beneficiaries who are either on a Medigap plan now or those who are currently on a Medicare Advantage plan and maybe not satisfied with it. If you are a Medicare beneficiary on a Medicare supplement, such as a Plan F, a Plan G, or a Plan N, and the rates have increased since when you first started Medicare and enrolled in the Medigap plan, rates have gone up on many of these plans recently due to the rise in the cost of healthcare. So let's start here and let's recap some Medicare details. Everyone starting Medicare Part B for the first time has an enrollment period of 6 months before and 5 months after your Part B effective date, where there are no medical underwriting questions. However, if it is after this golden period of 11 months and you want to switch carriers, yet keep the same Medigap Plan F, Plan G, or Plan N, or even switch from Plan F to Plan G or Plan G to Plan N or F to N, or if your situation is that you are currently on a Medicare Advantage plan and not completely satisfied with it and want to switch back to original Medicare and enroll in a Medigap plan, this video is for you. So make sure you stay to the end so you can receive all of this correct information. So when applying for a Medigap plan, one critical factor that can affect your coverage approval is underwriting. So let's take a closer look how this process works and what it means for your Medicare choices. Underwriting involves insurance companies assessing your health status during the application process. They review your medical history, your current prescriptions, your current health conditions, and other risk factors. Based on this evaluation, the insurance carrier for the Medigap plan must make decisions about accepting or declining your application based on your health. Most look at simply the pharmacy report, but some do look at a medical history. Unfortunately, there is a possibility that your coverage application can be denied based on your health. If you have a pre-existing condition or certain health issues, the insurer may decide not to offer you a different Medigap plan. However, many carriers now do have automated underwriting systems, which can lead to a much quicker approval in some cases. But you can also be denied by the automated underwriting system right away if you do take some serious medications or have a serious health condition. And remember, all of this is state by state. So there are a few states in the country that underwriting is not an issue, which I've gone over in other videos. Feel free to comment below if you need me to repeat that information. Now, let's discuss the importance of Medigap enrollment periods and how they relate to underwriting. The Medigap open enrollment period is an important time lasting a total of 11 months, starting on the first day of the month that you turn 65 or enroll in Medicare Part B for the first time, and it continues for 5 months after that Part B effective date. In this time frame, insurance companies must offer you any Medigap plan they sell without asking you any medical underwriting questions. This is your own personal open enrollment period when you first start onto Medicare Part B. So let's talk about Plan F. Plan F was discontinued to those who began Part A of Medicare after January 1st, 2020. Plan F pays all deductibles and the 20% coinsurance after original Medicare pays the first 80%. For those who started Part A of Medicare before January 1 of 2020, you are still eligible for Plan F. Plan F and Plan G are almost twins, with one exception. Plan G pays everything that Plan F does, except with Plan G, you pay per year that little Part B deductible, which this equals $240. Plan G is lower than Plan F in monthly premium by $50 to $60 per month. So let's do some quick math. $50 a month times 12 months in the year equals $600. Why would you want to pay an extra $600 just to pay off the $240 deductible? You're throwing savings in the trash if you're on Plan F and you're healthy and you don't switch to a Plan G. Plan F is a grandfathered plan and will only continue to go up in future years. Because Plan F has been closed and not accepting the young, healthy, new to Medicare beneficiaries, and because health insurance runs on the law of large numbers, you want to be in the biggest group possible, there's no doubt that Plan F's premiums will continue to rise far beyond Plan G. And those of you that are on Plan G right now, if you are healthy and your plan rates have increased over the last couple of years, you can also switch any time of the year to a Plan G or a Plan N or a Plan F with another carrier, because every Medigap plan is standardized by the federal government, and it makes no difference which insurance company that you have your Medigap plan, G, F, N. It could say McDonald's on your Medicare Supplement Medigap card, and your doctors and your hospitals will still accept it because you're on a Medigap plan, which keeps you on original Medicare. Original Medicare is driving the bus if you're on Medigap, and your Medigap plan F, G, or N is a rider on that bus picking up the balance of your medical bills. Underwriting for Medigap plans involves assessing your health status, and it can lead to denial of coverage for a new Medigap plan. But with the automated systems for underwriting, the process has become much quicker and much more efficient. If you are looking to lower your Medicare supplement premiums, or again, if you're dissatisfied with Medicare Advantage, you may be able to switch back to original Medicare and pick up Plan G or Plan N or even Plan F. But Plan F, remember, is more expensive. It's not the wisest choice. It's really important to make informed decisions when it comes to all this Medicare mumbo jumbo. And we're here to help you. I hope that this exploration of Medigap underwriting and being able to change plans when it's not the annual open enrollment period has been eye-opening and insightful for you. You can really save yourself a lot of money and have a much better Medicare experience if you continue to do your research. If you need personalized assistance, just drop a comment below, and don't forget to subscribe to the Medigap Show for more valuable Medicare insights. You can also find us at medigapcares.org and schedule a free appointment with either me or a trusted licensed member of my team. Or you can give us a call at the number below, 855-265-6334. We are happy to help you any time of year. I look forward to seeing you on the next episode of Medigap Show. As always, be well.